The Spanish flu pandemic, 1918-1920. The Spanish flu pandemic was one of the most devastating events in human history, infecting an estimated 500 million people, approximately one-third of the world's population, and claiming the lives of 20 to 50 million individuals, with some estimates suggesting as many as 100 million. Its rapid spread, tremendous mortality, and societal implications left a lasting imprint on global health, reshaping the way humanity addresses pandemics. This event, though often overshadowed by World War I, holds critical lessons about resilience, preparedness, and the profound influence of infectious diseases on human society. The Spanish flu pandemic unfolded during a moment of intense global upheaval, the final year of World War I. The mass movement of soldiers, combined with an increase in international travel, created the ideal conditions for the virus to spread rapidly across borders. Troop ships, camps, and crowded trenches acted as breeding grounds where the virus thrived and expanded to reach all corners of the globe. Ironically, the name Spanish flu is a misnomer. At the time, wartime censorship prevented many nations from reporting the outbreak to avoid damaging morale. Neutral Spain, unbound by such restrictions, openly reported on the pandemic, leading the world to believe the outbreak had originated there. This highlights how the combination of war and the pandemic complicated public understanding and response. The Spanish flu was caused by the H1N1 influenza virus, but its exact origins remain uncertain. Compelling theories propose that the virus might have emerged in Kansas, US, Europe, or even China, with military training camps serving as early hotspots of infection. Regardless of the original source, the global interconnectedness of 1918 ensured its swift and relentless spread. For history enthusiasts, the lingering mystery of its precise beginnings sheds light on the challenges of studying pandemics in a world vastly different from today's. The first wave of the Spanish flu emerged in the spring of 1918. Its symptoms resembled those of a typical influenza outbreak: fever, fatigue, coughs, resulting in relatively low mortality. At the time, the focus was heavily on the war, so this early phase passed with minimal fanfare or public alarm, even as the virus silently infiltrated numerous countries. In late August 1918, the Spanish flu returned with a vengeance. This second wave proved extraordinarily lethal due to mutations in the virus that made it far more dangerous. Victims often displayed severe, terrifying symptoms: high fevers, deep cyanosis, turning blue from lack of oxygen, and hemorrhaging from the nose or mouth. In many cases, individuals succumbed to illness mere days after experiencing their first symptoms, with secondary bacterial pneumonia frequently acting as the ultimate cause of death. Of particular historical interest is how the virus targeted young, healthy adults. Unlike most flu outbreaks, where the very young and very old are at the greatest risk, the Spanish flu disproportionately impacted individuals aged 20 to 40, decimating this vital demographic. A third wave emerged in early 1919, coinciding with soldiers returning home following the end of World War I. While less severe than the second wave, it still caused considerable mortality and further exacerbated a world already struggling with the war's aftermath. Remote communities, such as indigenous populations and impoverished regions, were hit particularly hard, suffering especially high death tolls due to limited access to healthcare and information. From bustling urban cities to isolated islands, the Spanish flu spared no region. Among the most affected populations were communities living in poverty, areas ravaged by war, and indigenous groups who lacked immunity to the virus. The global death toll remains staggering by any measure, reshaping societal landscapes and carving an indelible mark in the annals of history. The Spanish flu's death toll is astonishing, estimated between 20 and 50 million, though some suggest it could have been up to 100 million. Even more remarkable was the demographic pattern of deaths, with the pandemic cutting down able-bodied young adults in their prime. This sudden, large-scale loss brought unparalleled grief and societal disruption. For context, this death toll eclipses that of World War I itself, emphasizing the scale of the disaster. Understanding these numbers allows us to grasp the degree of collective human suffering during this time. The flu strained healthcare systems past their breaking points, leaving hospitals overcrowded and medical staff powerless in the absence of vaccines or effective treatments. In many cities, morgues were overwhelmed, leading to mass burials. Public spaces such as schools, theaters, and churches were closed, paralyzing daily life. This pandemic marked one of the earliest large-scale implementations of quarantine, mask mandates, and social distancing, measures that continue to be critical in modern public health strategies. Economic activity slowed dramatically. Workers in essential industries fell ill, supply chains faced frequent interruptions, and communities worldwide began to feel the compounded effects of war and disease. The Spanish flu pandemic starkly revealed the limitations of early 20th century medical science. Viral pathogens were still poorly understood. Antibiotics to treat secondary infections, such as pneumonia, had not yet been developed, and there was no vaccine available to prevent the spread. Much of the response relied on basic public health measures such as isolation, hand hygiene, and mask use. While rudimentary by today's standards, these measures were significant given the context of the era. Public health campaigns helped foster compliance and awareness, even if infrastructure and scientific preparedness were inadequate for a crisis of such magnitude. As the flu ravaged populations, wartime priorities took precedence in many countries. Public health resources were limited, and governments delayed both research and response efforts to support military campaigns. Censorship further stifled information flow, leaving communities unprepared and uninformed. This lack of transparency underlined the complexities of managing a pandemic in an environment rife with geopolitical conflict. By late 1919 and into early 1920, the Spanish flu began to fade. Survivors gained immunity, while mutations in the virus rendered it less deadly. However, the human and societal cost of the virus left indelible scars, with millions of lives lost and systems disrupted across the globe. It would be decades before the scientific community fully understood the nature of influenza viruses and their role in the pandemic. The Spanish flu taught humanity valuable lessons about the importance of global cooperation and pandemic readiness. It sparked advancements in the fields of virology and epidemiology, paving the way for research that eventually resulted in vaccines and treatments. Public health protocols for monitoring outbreaks and developing interventions can trace their roots to this tragic chapter. One of the astonishing aspects of the Spanish flu is how little attention it receives in popular memory, often overshadowed by the cataclysmic events of World War I. Known as the forgotten pandemic, its impact and significance have only recently been revisited by historians and epidemiologists, offering a reminder of how human narratives can shape the preservation or neglect of key historical lessons. The pandemic underscored the necessity of systematic tracking and reporting during health crises, precursor steps to the eventual establishment of the World Health Organization, WHO. From surveillance to data collection, many of the strategies for modern outbreak control stem from innovations and experiences gained during this tumultuous time. Today's annual flu vaccination programs owe a deep debt to the Spanish flu, which made clear that influenza was not a disease to be underestimated. The collective response led to renewed focus on disease prevention through immunization. Scientists studying the Spanish flu over subsequent decades identified the H1N1 virus and began dissecting its structure. This understanding has been critical to combating seasonal influenza and ensuring preparedness for future pandemics. The medical community rallied around the lessons of 1918, leading to the development of vaccines, antibiotics, and virology as a discipline. This legacy highlights how historical crises can act as catalysts for extraordinary progress, benefiting future generations. On a broader level, the Spanish flu revealed the profound interconnectedness of human society. The pandemic demonstrated how people, economies, and resources are interlinked and underscored the need for global solidarity to safeguard against shared threats. This global interconnectedness, though amplified in the present day, remains a crucial consideration in navigating health emergencies. The Spanish flu pandemic of 1918-1920 was a tragic episode in human history, claiming millions of lives and disrupting societies across the globe. Yet, from this devastating event came extraordinary lessons in resilience, public health strategies, and research advancements. It serves as a reminder of both humanity's vulnerability to infectious diseases and our capacity for innovation and adaptation in response to crisis. For history enthusiasts, the pandemic offers a vivid case study of how unforeseen challenges can reshape societies and galvanize scientific progress. The Spanish flu's lessons continue to resonate, inspiring modern responses to emerging health crises and reinforcing the importance of preparedness, transparency, and human cooperation. In reflecting on this past event, we are reminded that studying history is not merely about recounting facts. It is about learning from them to shape a better future.